Okay, let's unpack this. You've brought us some really fascinating sources digging deep into transient ischemic attacks, TIAs, and, well, what people often call minor strokes.
Right.
And I think the common idea is maybe they're just temporary blips, no real lasting effects.
Yeah, that's the perception.
But this deep dive into your material seems to show a much more complex picture.
It really does.
So our mission today, I guess, is to pull out the key insights from these sources about what actually happens after a TIA or minor stroke. Focusing on those lasting impacts and maybe most importantly, what the research says about prevention.
Exactly. And what's striking right away from your sources is, while the definition of a TIA means symptoms resolve quickly, maybe minutes,
Right.
the whole experience itself can leave a pretty significant lasting footprint. It's not just this fleeting thing that happens and then it's over.
Okay, that's a big takeaway right from the start. So beyond those immediate symptoms vanishing, what are these lasting impacts the sources talk about? What should someone who's gone through this, or maybe their family, really understand?
Well, your material points to a few key areas. One that pops up again and again is persistent fatigue, like a really significant drop in energy levels. Simple daily things that you didn't even think about before can suddenly feel, well, exhausting. It's not just feeling a bit sleepy. It's described as a deep, lasting weariness.
And it's not just physical energy draining away, is it? I noticed the sources also detail cognitive changes, things that might be quite subtle but still have a real impact.
Absolutely.
Yeah.
We see mentions of difficulties with concentration, finding it hard to focus, especially if there are distractions around. There can be issues with memory too. Maybe not huge memory loss, but like trouble recalling specific details or remembering appointments. Some sources even touch on changes in executive functions, things like planning or making decisions. Thinking just feels different, maybe slower for some people.
That sounds incredibly difficult and often invisible to others, I imagine.
Exactly. Very invisible.
The emotional toll seems pretty significant as well, based on what you read.
Oh, it is. Anxiety and depression are commonly reported afterwards. And maybe most surprisingly, especially for something termed minor, some sources mention behavioral or even personality changes.
Really? Like what?
Things like increased irritability or maybe becoming more withdrawn. Sometimes people might get sort of fixated on certain thoughts or tasks more than usual.
So it's clear these events aren't truly minor when you look at the potential aftermath.
Not in terms of impact, no.
And your sources really hammer home that a TIA or minor stroke is a critical warning sign. What are the key statistics or risks that jumped out at you?
This is probably the most urgent message, really. The sources consistently state that having a TIA or minor stroke dramatically increases your risk of a future, potentially much more severe major stroke.
Right, that's the big worry.
Yeah. One statistic your material brings up is that up to 1 in 3 people who have a TIA will go on to have a full stroke. And crucially, about half of those subsequent strokes happen within just 1 year.
Wow. 1 in 3 and half within a year. That really underscores the urgency, doesn't it?
It absolutely does.
Okay, so if these events are such a major warning, the focus has to shift immediately to prevention. What does your reading suggest is the core strategy for preventing that next potentially devastating event?
Well, it's definitely a multi-layered approach, according to these sources. Medical management is foundational.
Meaning
Aggressively controlling underlying conditions, blood pressure, high cholesterol, diabetes, often using prescribed medications. That part seems non-negotiable in the research.
Okay, medication and managing conditions. And then the sources dive pretty deep into lifestyle changes. These seem both essential and, honestly, often quite difficult. What are the key ones they mention?
Yes, the lifestyle piece is huge. Quitting smoking is paramount. Often the scare of the event motivated this, but the sources are realistic. They acknowledge it's still a big challenge for many.
Sure.
Limiting alcohol intake is generally advised, along with managing weight, trying to get into a healthy range. Regular physical activity is also a really consistent recommendation, usually suggesting something like aiming for 30 minutes of moderate exercise most days of the week.
Okay. And diet. That's another major pillar that came up, isn't it? Shifting eating habits seems critical for hitting those blood pressure and cholesterol targets.
Exactly. The sources really emphasize reducing intake of salt, saturated fats, and sugars, while, increasing fruits, vegetables, whole grains. Adopting something like a Mediterranean-style diet is often highlighted as being particularly beneficial.
It sounds comprehensive, almost overwhelming maybe for someone recovering.
It can be.
And your sources seem pretty realistic about the challenges people face in actually making these changes stick, right? What are some of those hurdles?
Yeah, they acknowledge that changing habits you've had for years around food or activity is just plain hard for anyone. But the sources also connected back to those lasting impacts we talked about earlier, that persistent fatigue. It can make the idea of exercising feel impossible.
Right.
Or those subtle cognitive issues might make it harder to plan healthy meals or even just remember medication schedules consistently. The fear of another event can sometimes be a motivator, sure, but it can also just lead to anxiety that actually makes change harder.
That makes sense.
Getting support from family, doctors, maybe dietitians or therapists is presented as really crucial. But the sources also sort of imply this support isn't always easy to find, or maybe people don't always seek it out.
And that need for regular follow-up appointments with doctors is stressed too, isn't it? To make sure these prevention strategies are working and maybe need adjusting.
Definitely. It's all about creating this robust, ongoing plan that's tailored to the individual's specific risks and the challenges they're facing. These events really force a kind of reckoning with health and lifestyle, prompting that longer-term thinking.
So, wrapping this up then, what does this all really mean? This deep dive into your sources shows us that a TIA or minor stroke is, well, anything but minor in its implications. It's a loud warning siren.
A very loud one.
Yeah, requiring immediate action to prevent a future stroke, mainly through medical management and these significant lifestyle changes. But just as importantly, your sources highlight these often under-recognized lasting impacts, physical, cognitive, emotional.
Like the fatigue, memory issues, anxiety.
Exactly, things that can hang around and make those necessary prevention efforts much, much harder than they might look on paper.
Which really raises an important question, doesn't it? Something for you, the listener, to consider. Given that your sources make it so clear, these minor events can have such significant, complex, and lasting effects. Effects that go beyond just the risk of another stroke. What more is needed? Or maybe, what conversations aren't we having to truly support people living with these often invisible challenges, beyond just telling them, okay, now prevent the next one?